Hello everybody and welcome back to my channel. I hope that everyone is staying safe and sound in this pandemic, and I hope that everyone is ready to learn something new. But first, if you like what you see, give me a big thumbs up. It really helps with the YouTube algorithm. Hit that bell notification so you know my videos come out. And please do me a favor and do yourself a favor. My current promo is $40 to a random subscriber who comments when I hit 200, but I need to do that before Monday when I go back to school. Right now I'm at 184, so we need 16 more. Okay, once Monday comes, the promo is not in effect anymore. Okay. So today is Wellness Wednesday. So some people have been talking about the COVID vaccine booster shot, so I figured let me do a little video about that. HHS announced a plan to begin offering COVID-19 vaccine booster shots this fall. CDC's independent advisory committee, the Advisory Committee on Immunization Practices, will continue to meet and discuss data on the evolution of the pandemic and the use of COVID-19 vaccines. ACIP will make further recommendations on the use of boosters for the public after a thorough review of the evidence. Currently, they're talking about, only the immunocompromised. That's what they're talking about, or the older adults. When can I get a COVID-19 booster? Not immediately. The goal is for people to start receiving a COVID-19 booster shot beginning in the fall, with individuals being eligible starting 8 months after they receive their second dose of the mRNA vaccine, either Pfizer or Moderna. This is subject to authorization by the U.S. Food and Drug Administration and recommendation by CDC's Advisory Committee on Immunization Practices. FDA is conducting an independent evaluation to determine the safety and effectiveness of a booster dose of the mRNA vaccines. ACIP will decide whether to issue a booster dose recommendation based on a thorough review of the evidence. Who will be the first people to get it? If the FDA authorizes and ACIP recommends a booster dose, people who were first to receive a COVID-19 vaccination when they became eligible in early 2021, which basically were those who are at risk, are likely to be the first people eligible for a booster. This includes healthcare providers, residents of long-term care facilities, and other adults. Why is the United States waiting to start COVID-19 vaccine boosters? The COVID vaccine authorized in the United States continues to be highly effective in reducing risk of severe disease, hospitalization, and death, even against the widely circulating Delta variant. However, COVID-19 constantly evolves. Experts are looking at all the available data to understand how well the vaccines are working, including how many variants like Delta affect vaccine effectiveness. If FDA authorizes and ACIP recommends it, the goal is for people to start receiving a COVID-19 shot booster this fall, which is fall now. Can people who receive Johnson & Johnson COVID vaccine get a booster dose of an mRNA vaccine? No. There isn't enough data currently to support getting an mRNA vaccine dose, either Pfizer or Moderna, if someone has previously gotten the J&J vaccine. People who got the J&J vaccine will likely need a booster close dose of the J&J vaccine. So if you got the Johnson & Johnson vaccine, you're going to need a dose of that, not the other one. Will people who got the Johnson & Johnson need a booster shot? So it's likely that they need a booster shot as well, because the data needed to make the decision aren't available yet. But it says that it wasn't given in the United States until 70 days after the first one. Okay. If we need a booster shot, does that mean the vaccines aren't working? No. The vaccines are working very well to prevent severe illness, hospitalization, and death, even against the widely circulating Delta variant. However, with the Delta variant, public experts are starting to see reduced protection against mild and moderate disease. For that reason, the U.S. Department of Health and Human Services is planning for a booster shot so vaccinated people maintain protection over the coming months. What's the difference between a booster dose and an additional dose? Sometimes people are moderately to severely compromised, do not build enough or any protection when they get the first vaccination. When this happens, getting another dose of the vaccine can sometimes help them build more protection against disease. This appears to be the case for some immunocompromised people and COVID-19 vaccines. CDC recommends moderately to severely immunocompromised people consider receiving an additional third dose of the mRNA COVID-19 vaccine, at least 28 days after the completion of the initial 2. In contrast, the booster dose refers to another dose of a vaccine that is given to someone who built enough protection after vaccination, but then the protection decreased over time. This is called waning immunity. HHS has developed a plan to begin offering COVID-19 booster shots to people this fall. Implementation of this plan is subject to FDA's authorization and ACIP's recommendation. So that's the current news. I've also heard that Pfizer is testing the vaccine for children from 5 to 11. And if that's approved, that would be great for the school children, because the children can get vaccinated, and if they get vaccinated, they may not have to wear their masks. I know a lot of children don't want to wear their mask, and a lot of parents don't want the children to wear their mask, but the wearing a mask is for the protection of others, not just for yourself. Because if you have the virus, you spread it to other people if you don't have a mask. So that'll be a good thing if they do authorize it. Right now, don't know, but it should happen. Okay. Again, if you like what you see, give me a big thumbs up. It really helps with the YouTube algorithm. Hit that bell notification so you know my videos come out, generally between 3 and 4. This is a family-friendly channel. And please subscribe to my channel. Do yourself a favor and do me a favor. One random subscriber who comments will receive $40 when I reach 200. But the promo expires before Monday, on Sunday. I'm going to be going back to school Monday, and I may not really even have that much time for YouTube. I may only be able to do like a video once or twice a week. Right now, I've been doing videos at least 5 times a week. So I really will not have time to work on that much on my YouTube channel. It's just that I will be busy with work. So let's see if we can get this done before then. I thank you. I will see you tomorrow, where we're going to be doing a back to school, and I will be telling you about the program that my school is offering and the schedule and everything. Take care, go out and get yourself vaccinated, and I will see you tomorrow.